Whatever your situation may be, never travel through irregular means. The terrifying ordeal of a Libyan returnee and a must-listen tale. Stick around for details. In strategizing on means of harnessing diaspora participation to strengthen national development discourse, the Chairman CEO, Nigerians in Diaspora Commission, Honorable Abike Dabir Erewa, held a strategic meeting with Hadiza Bala Usman, Special Advisor to the President on Policy Coordination, identifies Diaspora Trust Fund as an integral pact for a sustainable pool of diaspora resources. Details shortly. And now, in tackling the menace of irregular migration, the NIDCOM boss received in audience Ms. Isabella, Head of Mission, International Center for Migration Policy Development, ICMPD, stressing the need of all concerned to push further in discouraging irregular migration by offering more valuable alternatives. Stick around for more. And of course, do not forget our complimentary segment of health tips by Association of Nigerian Physicians in the Americas, AMPA, and our diaspora of the moment. This is your favorite show, The Diaspora, and I'm Khadija Bamali, your anchor. Please stay. Welcome back. Let's take a listen to Mercy Oluwabenga, a young Nigerian Libyan returnee, as she narrates her horrifying ordeal. Her story is a serious warning on irregular migration.
2021, I was working in Nebuka, washing their plates. So I heard a girl talking about Libya. It is not as if they deceived me. I willingly left because she said she was talking about Libya, that she's also going to Libya, and I said, okay, please, can I go with you because of work. When we got there, the person that brought us in, we paid the person a year and 6 months. A year and 6 months.
How long were you in Libya?
I went there December 2021. December 2021, so approximately four years.
So you were in Libya for 4 years?
Yes, ma'am.
And you paid your agent
a year
and 6 months salary. How
yes.
much does that amount?
Normally it was supposed to be 4 point something million.
Naira.
Yes.
And this agent collected from you?
No, but from me it was about 2.5.
Okay.
Yes. The day I made the video, I tried to run. During those time, my mom died already. I made the video and sent it to the blog that posted it. But after I sent out information, I deleted it. I wiped my phone because they normally collect my phone every 2 days to check my conversations and this and it's every month they used to change my SIM. When I got to the IOM, that was when I started speaking with Mrs. The chairman, Mrs. Abike Dabiri. Then they started processing. They spoke to my camp manager, so the camp manager started the process from there, and they were Mr. Abike Dabiri and everybody have been speaking to me from time to time. So when the ticket got out, I was able to get to the end. No matter the situation, don't leave the country, because due to my own situation, I was like, maybe when I get here, there I'll be able to send something to my mom. But when I got even 5 naira, I couldn't even see to send to her. She died. She died. So no matter the situation, even if you are seeing 10 naira every month, 20 naira every month, don't go to Nigeria. Is better than every country. In Nigeria, if you get a job and maybe they didn't pay you, there is a way you get your salary, and they won't treat you the way they treat you in that country. They treat us like animals. They treat us like animals. And even the people that they treat good, maybe the people that are here 20 years, those ones, and even Nigerians like us, sell us to them.
Now that you are back, what do you want us to do?
I would like to go back to school.
Welcome home. You are one of the very lucky ones. Because I'll tell you how I got to know about you. Dr. Shegu Abraham, who also runs Trinity Foundation, actually sent me your video where you made the distress call. Now, Dr. Abraham did not just send me the video. He said, I saw this video, how can we help her? Which is the difference with Nigerians who just send videos. He said, see this video, because I think my name was mentioned in the video. Yes. So he sent it to me and said, can we help her? So that's how I got in touch with the Nigerian community in Libya, the president of the Nigerian community in Libya. And he was able to ask around, and they were able to track her. Now, that's where you were lucky. Many others, you can't even get them. So you're lucky that they were able to track you because you had already escaped to an IOM camp. So they were able to get you. And I hope you're a point of reference for everybody to learn. Anybody telling you are going to Libya, where you're going to Europe, it's a lie. You're being sold into slavery, and then it's voluntary suicide. You're going on that journey to kill yourself. We thank God for your life. You are here today because you were lucky. There are many people that we can't even get to them. They are in detention. There are places you can't even reach. So my appeal is this, and you have said it, there are no jobs anywhere. There are no jobs in those. Now the agent is making money. So you are being sold to slavery. And those who take the narrative, oh, they are going because you had circumcised, but if you had remained here, you would have survived. But we're lucky that we're able to have kind-hearted Nigerians like Dr. Abraham, who paid. Dr. Abraham gave us over $1 million to get you back. Wow. And yeah, Dr. Shegu Abraham. And it's not a place where Libya is not like a normal place. We paid for different things, exit visa. If we're not careful, you will not get that flight. So we're glad you're here. So Dr. Abraham's representatives are here. Now, since it's about your education, we'll ensure that all funds are channeled into your education. And I'm sure, don't worry, you'll go to school, you'll survive. And thank Mr. President too. President Bola Ahmed Tinubu, he's determined that the welfare of every Nigerian matters. And on his behalf, we're going to make sure that you get everything you need and you do not suffer. And to everybody trying to go on that dangerous journey, it is not worth it.
The strategic meeting with the Special Advisor to the President on Policy Coordination, Hadiza Bala Usman, where both the Presidency and NIDCOM aligned on high-impact diaspora engagement strategies for national development and growth.
I believe there may be things that you're doing that we're not capturing within our delivery structure. I would like for you to bring those up. We had looked at high impact deliverables, we reviewed and on, but I honestly feel sometimes there are heads of agencies that are doing things that have not been captured, meaning likely at the beginning of the exercise, this was not priority for you, but in the course of doing your work, something may have come up and you're suddenly now giving it a lot of attention. So we'd like for you to relook at what you're doing that is not within the scope of what we're tracking to see if those things are considered high impact and what they mean for your organization, and we can put them. What this does is that it becomes in the eye of the president, so he's aware that this is something that is being done. Sometimes we spend a lot of energy on deliverables that are not being captured. So you are spending a lot of time, energy, and resources on something that the president is not seeing you doing. So this is why I'm glad you're here, and I would like for us to look at that if there's anything that you're doing that we haven't captured. But if indeed everything is the way it is, then it's fine. We can see what we can do to enhance collaboration. So thank you very much for taking time out to come.
The issue of diaspora is not actually like a priority, but it's very important.
It is.
So, one of the biggest things I think we have to do is have a diaspora trust fund. Okay. We've made the proposal. You see, because in doing all this, the diaspora is a low-hanging fruit. We're saying NSIA does what? If you say $600 million in a month, it's going up because we're doing things right. And CBN has come up with policies. We sat with them. The first person we visited was Cardoso on what needed to be done, and he's doing them. So I think this one, in fact, when we look at our figures, we're actually delivering. In the last 6 years, we can at least hospitals, business that have come to Nigeria, and we have them with the NDI, so we can do that. But we need to be supported to get it done.
Okay.
Now we're basically working with nothing. So it's even difficult going on those engagements. And now, Mr. President has started his diaspora engagements. So he himself
He has
is now
restricted them
saying,
from the last few trips I saw.
So Brazil, I mean, Brazil was wonderful,
Yeah,
you know, and I had 1 hour to do it. With this St. Lucia, fantastic. We can put that together and send to you with the NDIS report, because that's why we started Diaspora Investment Summit.
So do we put the trust fund?
Yes. So to be delivered, and everything is ready, the paper is there. We must have a pool of that will be managed by the private sector, by the diaspora.
Okay.
We will recommend someone like Bayo Gunese to chair the fund, Ali Garba to manage it. So two things: the diaspora will do that, and then the diaspora returning fund.
Okay.
So that when
Returnee fund?
let me explain to you.
Yes,
Somebody
please.
wants to come and set up a business, right? We can have a pool of funds working with Bank of Industry.
Yes.
There's a girl coming from Libya.
Yes.
You know what I'm saying? She has nothing to do. With 500,000 she can start a business. There is a guy who has a laundry outfit. He wants to grow it. So that encourages them. It can even be worked with any office, BOI, even any office. So that we can have something that we can say, okay, we take
So
it
can
very
it be
seriously.
part of the...
We can put it as part of it.
Part of the trust fund?
Any other thing? No. The trust fund is they are putting their money.
Yes.
The returning fund should be a federal government thing. What are you doing for these people?
Okay.
So there are two different things.
Okay.
One is bringing money. One is showing commitment. Okay, we're saying you're bringing $500 million. What are we
Which
giving
is
you?
more important here?
I think the trust fund.
The trust fund,
Okay.
yes.
Okay.
With the trust fund, you can. But the most important thing about the structure of the trust fund is it should be managed by them.
Okay. So with the returnee fund, is it something you mentioned BOI? Is it something that...
No, what I'm saying is just a proposal.
Okay.
If we have the returning fund in partnership with Bank of Industry, they can sit together and say, okay, this one qualifies. Look at this one. Okay, you want to start manufacturing pure water. How much do you need? There's
So within
part
the
of
scope of what they do, you can now
Yes.
have it, say, okay, this is
Yes.
specific for returnees,
Yes.
and then we can now...
Not negative returnees. No, not necessarily negative. So we can change the word. Okay, you want to come home. This is what you're doing. How can we help you improve? You don't have to come, but you're coming because what you do is in your country. So, but the trust fund, if that it will be a major win for the president. But the people that run it is very important. So that should be a major deal because we have everything. They are coming.
Now, to the strategic meeting between Chairman CEO NIDCOM, Honorable Abike Dabir Erewa, and Head of Mission ICMPD, Ms. Isabella, on curbing the menace of irregular migration. Please listen.
Thank you for the visit and thank you for being at the Diaspora Day and give such an amazing speech. We welcome you to Nigeria and you're one of the very first partners that we had to work with when the Diaspora Commission was set up, and you helped us with some capacity building. We've also worked with you on the Rabat process and a few other activities. So we're glad to receive you and just tell you that we look forward to more collaboration with ICPMD. What we're doing in the Diaspora Commission is about, human capacity development. It's about celebrating the best of Nigerians abroad and then encouraging them to look back home and see what they can do to be part of the programs and policies of the administration. We know we also deal with the issue of irregular migration, and we also try to advocate that there's no point going on those dangerous journeys. It's tough enough being a legal migrant, not to talk of being an illegal migrant. As I speak with you, there are many Nigerians still stranded in Libya. This is a place where we brought back over 10,000. We chartered planes, went to bring them back to Nigeria. Under this Tinubu administration, this is what, August, over 6,000 working with IOM have returned, but they're still there. We're still getting distress calls. So we want to embark on more advocacy, work with you, and just tell people that it's not worth it going on those dangerous journeys to Europe. And the Europe you're going to, they have their own challenges too. And if that happened in the past, not anymore these days. So we have a strategic plan we'll share with you, and we look forward to continuing to work with ICPMD because you are like our go-to when we first started, and you were there for us. And I'm glad you will see how far we've come in 6 years, but there's so much more to do. And we want to do it partnering with you and your other agencies and working with you in a lot of ways, capacity building, dealing with the regular migration, working with Nigerians all over the world, in fact, Africans all over the world, and see how we can work together to channel these issues and carry out the strategic plan that we have for the year and other years to come. So thank you for visiting. You're welcome to Nigeria, and we'll soon give you a Nigerian name. Thank you very much, and thank you for all the support.
Thank you so much. The first step is now the demand-driven facility, but as I also said, like you said, it's not just about who is giving you money, but also making it work for yourself. So I will also advocate with, when I speak with donors, when I speak with partners, on what your strategic views are, what your priorities are, where the needs are, and then let's also see how we can, how you can set yourself up within the government to also receive funding there, so that you can do the best for the Nigerians that are abroad, but also help them invest in their country, help them develop the country. This is where the strength lies. You gave such an amazing speech and interventions at the Diaspora Day, highlighting the strength of Nigerian remittances, of not only the financial remittances, but also the knowledge that they bring back, and everything that they've gained abroad, the networks that they have, and that is really where the development power for this country lies. So it's all in your hands, and I hope that we can support you that way.
Thank you very much. Thank you. We will be reviewing this next year, right? Next year, and I'm sure ICPMD will be part of this review.
For sure.
This was done in partnership with the IOM, and we will be reviewing it again. Thank you very much.
Let's take a short break. The Diaspora continues shortly.
My name is Olubenga Messi. I was once an illegal migrant in Libya. Thanks to Honorable Mrs. Abike Dabri, and thanks to Mr. Abraham for saving me, for rescuing me. I want to plead to Nigerians to say no to illegal migrations. Say no to anything illegal. Do not leave your country for anything. Just keep pushing and everything will be okay. There are some people that are out there that wasn't saved. Some people died. Some people didn't even make it to the country. Some people died in the desert. Some people made it to the country. They brought them back home mentally derailed. So we were treated like criminals. We were treated like animals. Some people, when they get to the country, without even working, prison straight. So please, I plead with every Nigerians, do not go to any country in the name of survivor. It is better to survive in Nigeria than to survive in another country. If you survive in Nigeria, you survive in any other country. Say no to illegal migration.
Everybody,
say no to illegal migration.
Welcome back. Now to our health tips segment with Ampar Doctor.
Telemedicine, as you know, has been out for a while now, made more popular during COVID. But what Ampar is doing with telemedicine is a little different. Whereas we have a lot of apps that are episodic in nature, you call when you have a cold, you see someone, but you don't see the same doctor, there's no management of any chronic disease. Ampar brings to the fore a new program of continuity of care. Let's remind ourselves of certain facts. We do know that the life expectancy in Nigeria is 55 years. We know that among the top 10 contributors to mortality includes chronic diseases like diabetes and hypertension. We also know that the physician to patient ratio in Nigeria is 1 to 10,000 when the WHO recommends 1 to 1,000. Therefore, there is no effective way to control the risk factors, to take care of patients, and to decrease and improve high, healthy living standards. This is where Ampar comes in with telemedicine. Telemedicine has become one very novel contribution to healthcare delivery in Nigeria. How does it work? We have a cohort of patients that we're piloting in Edo State PHC, about 50 of them. We're looking after their high blood pressure and their diabetes. We have shown so far in our pilot study that these numbers improve as we see these patients weekly and give them free medications. On Ampar side, we're spending about $1,000 per week per physician that is undergoing this consultation for free. We're also spending about $1,250 to provide free medications to the patients. And we are spending about $700 every week, again, for the incentive payment for the staff on the PHC level at the ground level. At the state level, the collaboration and partnership with the Edo State government has brought us into a partnership where they are giving us the telemedicine hub, which is the PHC. They are giving us the telemedicine software, and we are asking also for a vehicle to be transferring the patients to the telemedicine hub. All of this so far is reaching up to $35,000. So when you're talking about scaling up from the AMPA contribution to the partnership with the state government, we are looking at about $40,000 to $45,000 to establish a functioning telemedicine hub that we address those issues I just have. We are mitigating the physician shortage. We are mitigating the care continuum.
Over to our diaspora of the moment.
Our diaspora of the moment is Ethan Chidebere Nwaneri. Ethan was born on the 21st of March 2007 to a Nigerian parent. Nwaneri is an English footballer who plays as a midfielder for Premier League club Arsenal. Nwaneri started the 2022-2023 season playing for Arsenal under 18s, but such was his form he was quickly advanced to the club's under 21 side. Having made a sole appearance in the 2022-2023 Premier League 2, he joined the first team for training in September and made his first senior matchday squad on the 18th of September, when he was named as a substitute player for the Premier League match against Brentford. Coming off the bench to replace Fabio Vieira in the second minute of the second half stoppage time, he became the youngest player to ever appear in the Premier League, breaking the record previously held by Harvey Elliott, and also broke the all-time English top-flight record held since 1964 August by former Sunderland goalkeeper Derek Foster by 4 days. He also became Arsenal's youngest ever player in any competition, breaking the previous record of 16 years and 177 days set by Cesc Fabregas in 2003-2014 League Cup. Nwaneri made his Premier League debut against Brentford in September 2022, becoming the youngest ever Arsenal player and the youngest player to appear in the top flight of English football. Congratulations, Nwaneri. We celebrate you as our diaspora of the moment.
That does it for this week. Keep a date with us next week for another interesting episode of your favorite show, The Diaspora. I remain Khadija Bamali. Stay positive.